Hi everyone, my name is Brooke and I am a registered nurse. I have been a registered nurse since August of 2019. I first passed my NCLEX in May of 2019 after only studying for my NCLEX for 10 days. I am also the founder and creator of Shop Basics by Brooke on Etsy, which I'm going to tell you more about. On my Etsy page, it includes all of my notes and resources that I used to study for my NCLEX, which allowed me to pass my NCLEX in the minimum amount of questions in only 10 days. I am creating this video hopefully to reach more people so that my notes can be more helpful to others. So far on my Etsy, I've sold over 1,000 of my study guide, which is my most popular item, and then I do have a few other items that I'm going to tell you about as well. Keep watching and I will tell you about how I passed my NCLEX, what I did to study, and then I'll also share you tips and tricks. Make sure you check out the description below. It will include the times for each part of my video, so if you want to fast forward straight to when I talk about the notes, or you want to fast forward to when I talk about how I studied, you can do that so you don't have to watch necessarily the whole video. A little bit about how I studied for my NCLEX and how I passed my NCLEX in the minimum amount of questions in only 10 days. So basically, when I graduated my nursing program, I had originally thought that I would take several months to study. However, I was going out of the country for a few months and I wanted to at least try to pass or at least try to take it so that, you know, I wouldn't be as stressed while traveling. So just in case anyone's wondering, I basically had created the study guide for myself as a resource when I was studying for my NCLEX. I thought, at least I would have it to study when I got back from my travels in case I didn't pass. It wasn't until, a few months ago, I think it was back in August when I actually created the study guide and posted it on my Etsy, that I realized that it was actually really helpful to other people. So, I had maybe given my study guide to a few people back in nursing school, like a few people that were younger than me, and they thought it was so helpful. And then I realized, I have the ability to, maybe help other people pass the NCLEX as well. So the main goal of me, sharing the study guide with everyone is to help people who maybe struggle with breaking down information, because UWorld can be very overwhelming and a lot of the study resources can be very overwhelming because it's just so much questions and so much content. So my goal of my study guide is basically to break it down so that it's easier for everyone to understand. And I think it's really helpful and I've gotten a lot of positive feedback. So pretty much the only resource that I used to study for my NCLEX was actually UWorld. I downloaded like the 90-day program, and again, I only used it for 10 days. However, the way I actually used UWorld was I basically broke each day down into a different subject. So one day, I would study cardiac, do all the practice questions, take notes on everything. Even if I knew the right answer, I still wrote it down to help retain. I also made sure to highlight, important medications, blood work, things like that, that I could help separate out from just content in general. And then, say the next day I would go on and do respiratory. Now, again, I only had 10 days, so sometimes I had to combine some subjects. So, I'd maybe combine like some of the smaller areas, like I'd combine endocrine with, maybe like critical care. And I think I combined like fundamentals and leadership together as well. And then that did leave me with like 2 or 3 days to actually go back and look at my notes that I took and go back, take additional notes on my notes on the things that I got wrong, make flashcards, things like that. So I highly recommend UWorld. However, I do understand that it is expensive for a lot of people. And that's actually one of the reasons why I created my study guide. So I'll tell you more about my study guide, but essentially it is all of the information that I gathered from UWorld and all of my notes, and over 150 pages worth. So I'm going to get into that shortly. So before I get into my study guide, I also wanted to tell people who maybe aren't purchasing UWorld and maybe you're just purchasing my notes, what else I recommend using and what I also used. So I use the NCLEX Mastery RN app for my iPhone, and I think they have it on the Android too, but I'll include the link below for it and I'll show the little icon for what it looks like. This is a free app that allows you basically to do tons of practice questions on the go, which I thought was really nice. If I had a little bit of time in between classes, I tried to start doing these, when I was in nursing school, things like that. They also have a lot of acronyms and mnemonics, which I thought was really helpful. The other resource I referenced when doing UWorld was my Saunders book. So I didn't really use my Saunders book too much, but if there was, say, something like left-sided versus right heart failure that, I still wasn't understanding even after getting, a few practice questions on it and reading the rationales, I'd go into my Saunders book and just read more in depth about it. And then the last resource that I did use was ATI. So I didn't really use ATI, and I don't typically recommend using ATI to study for your NCLEX. However, for my nursing program, it was required that we partake in like this ATI capstone program. It was a few-day thing that basically gave us tips and study resources for our NCLEX. So I got like the comprehensive book, which basically summarized a lot of important diseases and things like that, which I thought was really helpful. So I have that, and then I also had my weekly tips and tricks that I got from doing the ATI assignments online. All of that is also included in my study guide. So I have an ATI section, and then the rest and majority of it is UWorld. In addition to that, I just have lab values, mnemonics, things like that. So I'm going to tell you more about my study guide coming up next. So to the side right here, I'm just going to show a little bit of what my study guide looks like. I'm just going to kind of scroll through it, but basically it is organized really in depth. You'll see the first page, I have just my recommendations and general tips. Scrolling down, you'll see, I have lab values, I have common conditions and diseases. You'll see it's broken down by ATI, and then it's broken down by UWorld. So one thing that I think is really helpful too is I actually include my scores from what I got on UWorld. Some people just like to see that. I also try to, highlight or make red any mnemonics or any important medications. And then the other thing that I think is helpful is I separate pharmacology. So for each section, so say respiratory, it separates, the medications and pharmacology content. So you're not, trying to dig through and, learn about the medications, because for a lot of people, medications can be, difficult to remember. So I wanted to make sure that that was separated for each area. The other thing that is included in my study guide is this little chart. So these have just, like 10 or so important things that I think are fun to remember. You can print them out separately. I'll show a few to the side so that you see what they look like. So my second most popular item is my cheat sheet. So it is 8 pages of resources that I have broken down and color coded of just important content that I think people should know. I think it's really helpful for nursing school in addition to the NCLEX. So you'll see on the first page, it talks about lab values, vital signs, things like that you need to know. On the second page, I know you guys only see the headers, but it's like common medications and classifications. Third page, developmental milestones, pregnancy drug categories, maternity information. On the next page, there's cultural considerations, which is really helpful because it's important to know how different cultures perceive, say pain, for example, and how that could, proceed to your care. So, important things to pay attention to in your caring for a patient. You'll see mental health, a little information there. Then start getting into the information that I really like common diets. That's stuff that's really important to know. So say, for example, celiac disease, people are typically gluten-free. Cystic fibrosis, you want to make sure that people have a high calorie, high fat diet. Kidney stones, make sure they have a calcium controlled diet, things like that. And then just some miscellaneous tips, talks about a little bit of delegation there. And then these are my favorite pages. So this one is on positioning clients. So think about, like how you should position a patient for thoracentesis, how you should position someone if they're having an asthma attack, how you should position someone if they have prolapsed cord, if they, just had cleft lip procedure. So this is for all ages. And it includes, like procedural stuff or just diseases in general. And then it continues on to this page. And then we have common signs and symptoms of, those common diseases, which I think is really helpful. So like Kawasaki syndrome, strawberry tongue, Down syndrome, protruding tongue, bulimia, chipmunk face, lots of other things, pyloric stenosis, olive-like mass, and it kind of goes on and on. So many signs and symptoms there that I think are really, really helpful. So people really love these cheat sheets. I've gotten nothing but positive feedback. I think that they go especially well when used in conjunction with my study guide. So if you are studying for the NCLEX, I would recommend purchasing both. If you're just in nursing school, probably could start with the cheat sheets. However, you're going to find a lot of really helpful information from my study guide as well. So highly recommend those. And then I'm going to tell you about my third item, which is my mnemonics listing. I do have other items on my Etsy page. However, it's my mental health, my pharmacology, and my acid-base balance. All of those are included in my study guide, so you don't need to purchase those separately. So my last resource that is super popular that I really like is my mnemonics listing. So I created over 70 visual aids that have mnemonics and acronyms to help you remember key information for the NCLEX or even just for nursing school. So I actually, determine the colors for this. I put images in just to help it be easier for you to, retain this information. So I personally like mnemonics and acronyms. So if you're similar in that way, I highly recommend these. Again, great when in conjunction with the cheat sheets and the study guide. One thing that is great about all of my resources is that they are all instant downloads. So if you go to my Etsy page, again, Shop Basics by Brooke, you purchase these and you will immediately get an email, or if you go to the You section on your Etsy and your purchases, you will be able to download those PDF files immediately. So you don't need to wait for me to ship them. You will have instant access to them. I always encourage people to, print them out if you do have access to a printer. I know it's kind of a lot of pages, especially the study guide being 150 pages. With the cheat sheets, I recommend printing them out, maybe sticking them up on your wall so you can always look at them. They're color-coded, so they look really nice. But my biggest thing that I always say is take notes on my notes. So you can read over material as many times as you want, but no matter what, the best way that you're probably going to retain that information is by taking notes of your own. So go through my notes, highlight, bullet point, make flashcards of lab values, etc. So to the side, I'm just going to show some of the reviews that I've received on some of my items. I just want to let you guys know that, I am a real person. I have created this content to help others and people have found them helpful. So hopefully by sharing these reviews, you'll see that they can be helpful to you as well. Another thing that I want to mention about my resources is that they aren't just for the registered nurse, they can be used for LPNs as well. So the biggest difference in my resources would just be maybe like a very small area that might talk about different scope of practice. So as long as you know your different scopes, I don't think it's going to be an issue for you. My cheat sheets really don't mention anything that would only pertain to the registered nurse. Under the miscellaneous tips, there is a few things about delegation and scopes, but if anything, it's just providing more information. And then in my study guide in general, I don't think it goes very much into different scopes. So overall, I've had many people who are LPNs purchase all of my resources and they find them helpful as well. Thank you guys so much for watching my video. This is my first YouTube video, so I hope you guys like it. I put a lot of work into all of my resources and I really hope that they can be helpful to you. Make sure you use my discount code. The code is YouTube and I will put it below to save money on all your purchases. The great thing is that you can use this code to check out if you buy multiple resources. It doesn't just apply to say if you only purchase one resource, so definitely use the discount code. And make sure you subscribe to my channel in case I do make more videos, favorite my shop, and if you have any questions, please leave them below, and good luck on your NCLEX.